Dr. Sarah Sunderland, one of the anesthesiologists here in Kelowna. This is what my PQI project was on. I'll also just say that my quality assistant, 5-month-old Quinn, is in the buggy at the back, and I would have had her up here because she's been to pretty much every single meeting I've gone to with this project, but she's totally asleep, so we're just gonna let the sleeping baby sleep. So this project grew out of the knowledge that surgery is stressful for children and parents, and we can actually measure that stress. Children have regressive behaviors after they have surgery, so this might include bedwetting, difficulty getting ready in the morning when those were previously acquired skills that they had, tantrums, acting out in school, nightmares, regressive behavior, things that they used to be able to do but for a couple days seem to struggle with. And research has shown that if we prepare children and their families for surgery, that they do better from a number of markings. So first of all, they have less of this regressive behavior, they're less distressed, they're less aggressive after surgery, they might have fewer of those behavioral changes, and they're less, there's less of an incidence of delirium after they wake up. These behavior changes that can happen with children are also especially worse for children who fall on the autism spectrum disorder. And we know for these families that can be even more devastating for them to have these changes. So in terms of Kelowna's own personal story for pediatric surgery, we're a relatively big center. We're IH's largest pediatric surgery center with about 800 cases a year. And we don't actually have any specific process that helps families or children get ready. They go through the exact same process as all of our adult patients. We don't even have little Finding Nemo decals on the wall or anything like that. We're really quite adult focused in that regard. So first of all, we wanted to figure out what our population needed and whether or not our parents and children in our community even wanted preparation tools. So we did a bunch of background work after we finally got privacy and ethics approval, which took quite a while, not because we were doing anything sketchy, but just because the process is pretty slow. So that's something that's being worked on. And basically, so we handed out 50 surveys. We did that in January of this year. We did 2 focus groups with parents of children who fall on the autism spectrum and parents of neuronormal children. We also did follow-up phone calls with parents to find out if their children had had any regressive behavior. And so what we heard back from the parents is, first of all, families were relatively happy with the care that they were receiving at KGH. We, on average, had a satisfaction rating of 9 out of 10. Which is pretty good, but we didn't stop there. We did hear that back that we need to make our center more child and family friendly, so having a specific waiting area for children and their families when they're waiting to go in for surgery. And we also heard that our preparation tool was thought to be useful or very useful by families. When I did a follow-up surveys on the phone, we found that 79% of kids in our community had one of the 12 regressive behaviors that we asked about as well. So there's room for improvement there. So families said that they would like to have a handout for parents and children to help them get ready. They thought a video and a storybook would be a great idea. For anyone familiar with autism and sensory perception disorder, social stories is really helpful, so we're going to use that format. We're going to use the diverse abilities handout sheet that'll go in the chart to help healthcare providers specifically address the needs of those children. And we're also going to work on some staff training for some of our more special needs children. And we're going to work on our daycare atmosphere like we talked about. So where are we right now? So we're securing funding for our video production. We have a videographer, and we're hopefully going to be filming in June or early July. And then we'll measure our change to see if we have a difference. And in my last 10 seconds, I just want to say special thanks to the PQI people, Erica and Ray, and the administration who were very accommodating with me, with my 1- and 2-month-old baby lugging around with me, and even made special arrangements for us to have a hotel room at one of our meetings, which was very much appreciated. Thank you.